Talk Live with Liz, sponsored by TriHealth.
And good afternoon once again at Health Talk Live today. Colds, flu, RSV, all are circulating in the tri-state. Many of those cases in children. Joining us now with how to separate the symptoms so parents get the right treatment for kids, Dr. Joe Bailey of TriHealth Pediatrics. Good afternoon to you. What's topping your list these days?
You just named it. It's colds, flu. We're seeing a large amount of RSV. We're seeing some COVID and of course the strep throat that goes around this time of year. But a lot of cold viruses, and that's leading to a lot of coughs in a lot of kids.
Now, I know normally when you say it's a virus, you just have to sort of let it run its course, but I'm hearing that any of these can cause this chronic cough for weeks. So we have a few questions about that. Number one, what causes that? And number two, are you still contagious when you're sort of giving or having that cough?
In the initial phases of the viral infection, you are contagious. Later on, which might be a week or even two later, you're not necessarily contagious, but your lungs are definitely irritated by the virus. So we recommend seeing your physician, find out if this is viral or if it's bacterial. If it's viral, then there are some things that you can do. You can drink more water. You might be wheezing. There are medications to treat wheezing. And some wheezing's caused by RSV. RSV is very irritating to the lungs of especially the small infants. It can cause them to wheeze, it can cause them to breathe harder and breathe faster. So if you have any of these symptoms, whether it's a chronic cough, we recommend seeing your primary care physician to determine whether this is something that we can help out.
Yeah, I know that it sort of can trend worse and become, you know, a greater infection. So certainly seeing you can make a difference. What about treatments?
If the lungs get some fluid in them, they get mucus that builds up, you can get a secondary pneumonia. So if you have a pneumonia, you need antibiotics. If it's just wheezing, depending on what the cause is, there are medicines that can help with wheezing within the lungs. And then, as I said before, if it's a pneumonia, if we hear mucus in the lungs, that makes us think that there's an infection, we can do chest x-rays to help determine that. We can also give antibiotics to help treat the infection. Yeah,
excellent. All right, last thought. Can any of the antivirals be used in kids for COVID or flu?
We give antivirals for the flu virus for sure, and for those patients who have COVID and are at high risk, there are antivirals that can be used in the pediatric population. But as a general rule, for COVID, we do not use the antivirals unless there are significant risk factors.
Yeah, really important information for parents. We love talking to you, Dr. Bailey. Thank you so much for your time today. If you need a pediatrician, TriHealth Primary Care would love to have you give them a call, 513-853-2100. Thanks for being here today.
Mm-hmm.